Laparoscopy is a surgical procedure that examines the organs inside the abdomen and other closed spaces. It's a low-risk, minimally invasive procedure that requires only small incisions, giving it the name keyhole surgery. In laparoscopy, surgeons use a specialized instrument called laparoscope, a thin tube with light and camera, inserted through one of the three incisions via trocar, allowing surgeons to pass instruments and excise tissues. Pediatric laparoscopy procedures improve the recovery time of the patient and decrease the chance of post-surgery complications. However, surgeons face a steep learning curve when developing their laparoscopic skills. Working in a confined 3D environment with a 2D view and limited range of motion. In addition, current simulators often lack constructive feedback and require expert supervision and guidance. Our team has developed a training simulator for pediatric laparoscopic surgery that provides real-time guidance with various forms of feedback and reduces reliance on expert supervision by using collected sensor data, machine learning, and signal processing techniques. Our simulator applies augmented reality to overlap digital information on the physical environment. Through a live view of the platform, the simulator is able to alert the trainee to their hand movements, the force they apply, and the runtime, guiding them through task procedure by highlighting the objectives. To build a compact system, we have implemented an Arduino Nano to collect data from the sensors mounted on the trocars. These sensors capture 4 types of movement: roll, pitch, yaw, and surge. In addition, we built a platform that captures bidirectional forces using bar load cells. With this platform, we are able to assess the used force, since it takes 1 Newton force only to tear tissue in pediatric surgeries. We then analyze the recorded trial to automate the labeling process of hand movements using gesture recognition techniques. By replacing manual labeling with deep learning models, our system has become precise and efficient. This automated approach will recognize and label surgical gestures in real time without human intervention. Trainees can read surgical facts while the data is being processed, to provide them with feedback supported by the auditory guide that you will hear now.
Video feedback to view your performance along with an expert's performance side by side. You can use the buttons on the bottom to play, pause, or skip to the next video. Visual feedback to evaluate your motion parameters throughout the procedure. Notice differences in the performances. Finally, tool trajectory to assess your tool handling skills.
Overall, our simulator bridges the gap between the current challenges in the surgical field and the growing demand for modern training evaluations.